suppose I'm going to start with saying I am a bit biased to this team because I've been part of the team for 25 years, and during that time they've had so many changes, so much thrown at them, but actually they're a brilliant team and they've adapted to everything that's been thrown at them over those years. This year, I mean, the COVID hit and I think we all were quite protected and thought that actually this wasn't really going to make much difference to us, and we carried on merrily operating, and and then on the 18th of March I was actually off that day and got a phone call from one of the team to say that was the last day of elective operating, and it had just come like a sort of bolt from the blue, I suppose. So the next day I got together, we had two assistant educators who'd really just started in post, and I got together with them to look at what did we need to do to adapt the team again to be able to cope with this. So we were carrying on doing cardiac because they were urgent patients, and thoracic again because it was cancer, but pretty much everything else was stopping. So we had lots of people in the team who weren't going to be doing their usual job. So we looked at where people were in their competencies, and actually then what would I need as a scrub nurse in orthopaedics normally, what would I need to be able to circulate in cardiac, to be able to be a theatre assistant in cardiac? What skills did I need that I didn't have as a scrub nurse in orthopaedics? And then we looked at what we needed to fill that gap and what kind of training we needed to put in place.
The whole pandemic, it's been an incredibly challenging time since it all started, but before COVID hit, I was looking after thoracics and general surgery, and obviously we did a lot of elective general surgery. So of course as pandemic hit, all our elective surgery stopped, and we were then asked and challenged to take on a lot of the extra work from all the other hospitals, all the urgent cancer work. So we were asked to do urology, ENT, GIN, lots of really complex cancer cases that a lot of the staff had never done before.
We've had to be redeployed to critical care out with their comfort zone. Obviously we've provided some training with that, but we can't remove all of the anxieties around about this, especially when people have been working in theatres or their specific environment for many number of years. Most recently it's been rising to the challenge of the new services that we've had. For example, colorectal cases and gynaecology cases, so these patients are coming through, they can't get their procedures done elsewhere, and we're providing that service here. Education department, they've also had a huge input into that, and whether it's been on the day training or trying to capture some training in advance of specific patients that are coming through. We've also been working in collaboration with the neighbouring health boards to see if there's any specific kits that we need or any specific education that we require around about the procedures that we're going to be doing from them as well.
It was quite a traumatic experience for the staff, going from doing our normal hip and knee replacements to doing major abdominal work, which quite a lot of staff didn't have these skills. So it was actually quite a scary time for most of the staff and for us, and with a lot of apprehension and a lot of people worried during the whole pandemic. Well, during it was then, and they started to recover, and they were started in the cancer patients, so it's getting people going from, especially orthopaedic nurses, they were the ones that had the biggest challenge, because they went from doing elective surgery, which is life-enhancing surgery, and it makes patients walk better and gives them a better quality of life to patients that were actually cancer patients. So it's life-saving surgery. So that kind of mindset of people going from life-enhancing to life-saving, and knowing that there's actually, these patients have cancer and they have tumours, and it was quite a different mindset in trying to get that patient, for them to process that, and as soon as they process that, then for them to actually do the job. But there has been a lot of people with anxiety issues over it, and a lot of stress, and we're short staff, so there's been a lot of pressure and the staff have felt it.
There's also been a real big challenge for a lot of staff emotionally with a lot of the patients that we've met. Some patients who have been really grateful to get their surgery during a time like this, but also really scared to be in hospital during this pandemic, worried that they've come in free of COVID and wanting to stay free of COVID. And so there's been a lot of big emotional impact on the staff with that as well.
Well, I've had cancer diagnosis twice in the past. I just knew that I couldn't live with this. It's a cancer diagnosis, but something needed to be done about it, regardless of what that was. So I knew, having Googled Mr. McKendra, knew that he was the best of the best in this area, and I was really happy to put my leg in his hands, as it were, and get on with the operation. It was a little bit daunting, I have to say, knowing that if the operation hadn't worked out as he wanted it, that it would mean an amputation. That was a little bit, that worried me a little bit, but I got my head round it and accepted that that's what it was going to be. If the operation didn't work out, that was what it was going to be. I felt I was in very, very good hands, and just wanted to get on with it and get this tumour out of my leg. I just felt confident that he was going to do the very best for me and do a good job. So, and he has a wonderful job.
And that for us, and that's what we're saying, you know, that we'd never done anything like that before. We're here, particularly in orthopaedics, you know, it's very much, you know, an elective, joints, hips, knees. We would never have seen anything like this before. So that has been, and I think for the staff, that is just an amazing feeling. We've learned loads, you know, and I think the positives out of that have been just incredible. The fact that we've been part of that, it's a, you know, pioneering. It's just incredible to have been involved in it, and it was a massive learning curve for us. So we were suddenly like, you know, so that took a lot of organisation, a lot of planning, lots of people getting involved, but again, people just digging in and really, really working hard to make sure that that happens. And it's, and you think, oh, how are we going to, but we get there and you do it, and then you get a result like that, and it's absolutely incredible.
In September, we introduced the 4 Nations pathways, and that changed things for us again. So we dismantled the 2 COVID theatres that we had set aside for dealing with COVID patients. Surgery was practically back to full capacity, albeit different from what we'd done before. And we then introduced, you know, green, amber and red pathways with the intention that the vast majority of our patients would be green. So for a lot, we had to adapt to amber pathways, particularly in endoscopy. And you know, the team were supported a lot by myself, by the rest of the senior team in theatres, and by infection control, who were, you know, worked with us the whole time to make it happen.
So obviously our recovery areas take the patients post-op. However, due to social distancing and obviously the Health Protection Scotland guidelines, we had to reduce the number of bays that we could provide. So we're now down to 7 bays in recovery. As you can imagine, that provides its challenges. We still have quite a high proportion of theatres working, so on any day we could have 14 or 15 theatres still working. Trying to provide the post-op care for all these patients within 7 bays requires a huge amount of planning. The recovery staff do an excellent job at getting the patients down in a timely fashion, not keeping them in recovery pre-op, getting them into the holding bays within theatre, and then post-op making sure that they're safe and comfortable and discharging them back to the wards. There's a lot of liaison with the other ward areas, making sure that they've got the staff to come and pick up the patients as well. So there is a lot of working as across 2 different departments to ensure that we have that continuity of care.
Yeah, the anxieties at the beginning, I think as well, establishing all the pathways of the patients and where they're being tested and where they're coming in on green pathways, amber, red, the challenges of setting up a theatre when we did get a COVID positive patient, how we dealt with that. I think the other thing we found really difficult was the fact that we're now all wearing masks routinely. You know, yes, we're all used to in theatre wearing masks, but I think it was that initial, you know, when you're wearing FFP3 masks, so full PPE, you know, the communication is not so good and between colleagues, between patients when you're chatting to them, and that is really, really difficult when you're trying to allay somebody's fears, and you've got full visors on, you've got FFP3, it's difficult to hear, and I think for them that must have been just, I mean, so scary. And I think that, you know, coming into the department like that, and but a lot of our staff just wearing all that full PPE and wearing it for, you know, if you're scrubbed for long periods of time, so 5-6 hours, you know, with a full mask, it's really tight. It's hugely challenging, and a lot of people really struggled with. You know, we had a lot of staff with a lot of bruising.
It's been a real challenge over the last year, but as I say, the team have been brilliant and adapted to every challenge that's been thrown at them over the last 25 years that I've known them, and this was another one that they have really adapted to and continue to adapt to as things continue to change.